What's up, guys? Welcome back to the channel. Drew here from the Dermatology Collaborative. I'm a practicing dermatologist in Kentucky, and welcome to the channel where we discuss all things skin related. In this video, we're going to discuss firefighters and the risk of developing skin cancer. The two main questions we're going to answer today are, do firefighters have an increased risk of skin cancer? And if yes, what is the mechanism underlying this increased risk? Let's dive right in. Do firefighters have an increased risk of skin cancer? Although the data is not super robust, and we'll see why, the answer appears to be yes. Firefighters do have an elevated lifetime risk of skin cancer when compared to the general population. Let's look at the data. In 2014, a study published from Finland looked at populations of firefighters from 5 Nordic countries, including more than 16,000 male firefighters. This study evaluated the risk of all types of cancer and found a statistically elevated risk of developing melanoma and non-melanoma skin cancer in firefighters. The risk of melanoma was higher among younger firefighters, that is, those aged 30 to 49, whereas the risk of non-melanoma skin cancer such as basal cell carcinoma or squamous cell carcinoma, aka keratinocyte carcinomas, appeared to be higher in older firefighters, that is, those aged 70 years or older. In 2022, a systematic review of case control studies showed that male firefighters have an increased melanoma risk compared with all other occupations. Without getting into the fine details, basically this review analyzed rates of skin cancer among cases which represented firefighters compared to controls which represented anyone else, meaning all comers who were not firefighters. According to this review, the risk of skin cancer in firefighters was between 1.4 and 2.9 times that of controls. Interestingly, 2 of the 5 articles analyzed in this review used police as the control group, and one of those articles actually found an even higher risk of skin cancer in police officers compared to firefighters, who did display an elevated risk compared to all other occupations. You can't exactly draw a definitive conclusion from a single case control study, but it's an interesting data point, which it seems to suggest that police are also at an elevated risk of skin cancer, specifically for developing melanoma, but that will be an entirely different video going forward. Also in 2022, a study published from Ontario, Canada, evaluated rates of skin cancer, all cancers for that matter, in firefighters and also in police. This study included more than 13,000 firefighters and more than 22,000 police officers. The risk of developing melanoma was found to be elevated in both firefighters and police more than twofold or 2 times when compared to all other occupations included in their control dataset. A study from 1986 not only examined rates of skin cancer in firefighters, but specifically looked at rates of death from skin cancer and found that death from skin cancer was elevated in white male firefighters. The proportionate mortality ratio from skin cancer was 1.48 times the general U.S. population. The same study similarly showed an elevated risk of death from skin cancer in police officers. In addition, the study found that the longer the employment as a firefighter, the greater the risk of death from skin cancer, suggesting a cumulative occupational hazard. Curiously, when the control group was narrowed to the New Jersey white male population, the significance of these results was actually lost. Again, it's hard to draw a conclusion from a single study and this last data point, other than perhaps being a white man from New Jersey itself is a risk for developing skin cancer and dying from it. And now I'm just going to kind of rapid fire through the literature just so we can get through all the data. Meta-analysis from 2019 showed an increased risk of melanoma in firefighters, but not non-melanoma skin cancers. A survey-based study in 2018 found that of nearly 2,400 respondents, 4.5% of firefighters employed in South Florida reported a history of any type of skin cancer. The self-reported age at skin cancer diagnosis was between 38 and 42 years of age. 2020 meta-analysis showed an increased risk of melanoma in firefighters. A case control study from 2014 examined 2,200 Scottish firefighters over a 20-year period and found elevated incidences of melanoma compared to the non-firefighter population. Death from melanoma was not found to be significantly elevated, however. And interestingly, according to this study, overall cancer incidence was lower in firefighters compared to the general Scottish population. And that's actually contrasting the data from most of the other studies I've reviewed. A Canadian cohort study published in 2018 found an elevated risk of melanoma in firefighters as well as police. And lastly, a Swedish cohort study from 2020 found an elevated risk of non-melanoma skin cancers among firefighters, but did not find an association between risk of skin cancer development and length of career as a firefighter, which again contrasts with the data I just talked about. That was a lot of data. Wow. I should mention that some of the data may be overlapping because studies that are structured as meta-analyses tend to evaluate all existing data, and I cited more than one of these meta-analyses. This body of data does support the observation that firefighters have an elevated skin cancer risk, and some of the data did show an increased risk of dying from skin cancer. But, and very importantly, I wanted to share the other side of the data. There are some studies, albeit much fewer in number, that do not support the hypothesis that firefighters develop skin cancer more commonly than non-firefighters. A 2018 Nordic cohort study evaluating more than 1,000 male firefighters from 1958 to 2012 did not show an increased risk of melanoma. This study did show an elevated risk of stomach cancer, so they did find a positive signal for cancer, but not specifically skin cancer. A cohort study from 2022 looking at Norwegian fire departments found a trend in elevated risk of melanoma, but this trend did not reach statistical significance. And lastly, the same set of conclusions was drawn from a Danish study published in 2018, namely a trend of increased incidence of melanoma, but a trend that was not statistically significant. I think it's important to understand that the overall body of medical science does seem to indicate an increased risk of developing skin cancer in firefighters. That being said, the overall risk is not huge. And I say this to hopefully encourage firefighters to keep at their careers and not just give up hope because of this information. It's just one example. The 2014 Nordic study I cited earlier showed that in a younger cohort of firefighters, melanoma risk is 1.6 times the general population. But if the incidence, meaning number of new melanomas per year, is 30 per 100,000 people, if we extrapolated that data from this specific study, then firefighters may have an incidence on the order of 50 cases of melanoma per 100,000 firefighters. That's certainly not a trivial number of melanomas. Every melanoma diagnosis really does matter because melanoma can be a fatal skin cancer, but I wanted to provide some context and perspective when interpreting this data. I think the other important point to take away from these studies is that firefighters are at an elevated risk for cancer in general, not only skin cancer. Many of the studies that I referenced in this video also showed a positive association between firefighters and GI tract cancer, respiratory cancer, including lung cancer and mesothelioma, multiple myeloma, which is a type of bone marrow cancer, lymphoma, a type of cancer of lymphoid or immune tissue, prostate cancer, and testicular cancer. So skin cancer seems to be one among many cancer associations of being a firefighter. Let's get to the second question. Why are firefighters at an increased risk for developing skin cancer? In other words, by what mechanisms do they acquire this intrinsically elevated risk? Occupationally, firefighters are exposed to a wide range of potential and known carcinogens, which are cancer-causing substances or exposures. Fire smoke contains a variety of compounds that are harmful, including benzene, formaldehyde, polycyclic aromatic hydrocarbons. These would include compounds like pyrenes, phthalates, and anthracenes. I'm sure you've heard of phthalates before. Sometimes it's on those skincare products, actually, that you look at the label. And fine particulate matter. Firefighters are often exposed to very high quantities of these compounds during their actual fight with a fire. There's data that show that they end up excreting these compounds in their urine as metabolites, which clearly links fire smoke to excretion of these compounds. Their exposure includes inhalation as well as through their skin or dermally. And I'll be posting a follow-up video specifically discussing the skin barrier and how it works to keep toxins outside the body, but many of these compounds are actually polyaromatic hydrocarbons, and due to their hydrophobic or lipophilic structures, they can actually readily penetrate the skin and enter the body. And although these exposures are short-lived, the high quantity of these levels and ongoing exposure through personal protective equipment, such as fire repellent clothing, keep the firefighters' exposures longer than would be expected for fighting a fire that is a short-lived thing. These compounds can adsorb, not absorb, but adsorb to their clothing, meaning they can attach to the surface of their clothing and then act like as a reservoir to slowly release the compounds onto the firefighter's skin, which allows them to absorb it through their skin and prolongs their exposure to these deleterious compounds. Dermal absorption seems to be highest with these polyaromatic hydrocarbons, such as those found in fire smoke, again, such as 1-hydroxypyrene and 1-hydroxynaphthalene, and lastly, di-2-ethyl hexyl phthalate. These three hydrocarbons are not yet categorized as type 1 or definitive carcinogens, but they are presently categorized as reasonably anticipated to be human carcinogens by the National Toxicology Program's most recent or 15th report. In addition, firefighters are also exposed to asbestos, which is a well-documented carcinogen previously used in insulation before modern forms of insulation were developed. And firefighters fighting fires in older buildings may in turn accumulate significant exposure to asbestos on the job. Asbestos exposure strongly correlates with the risk of mesothelioma, which is a type of cancer that actually develops around the lungs. It's the pleura, or the lining of the lung. It does cause mesothelioma. Asbestos exposure has not been specifically associated with skin cancer, but I'm actually not aware of a study that sought to evaluate the link between skin cancer and asbestos exposure. In addition to asbestos, firefighters are also exposed to diesel gas, which was recently categorized as a type 1 carcinogen, particularly in terms of causing lung cancer. It would seem that the entirety of exposure to carcinogens may predispose firefighters to skin cancer. In addition to these exposures, thermal injury, meaning heat from the fire itself, appears to play a role in skin cancer development. There's a skin condition called erythema ab igni, which is a lacy and reticular rash that people develop if they have long-standing exposure to low-grade heat, namely things like using heating fans, heating pads, and heating blankets. It's actually a precancerous rash, and parts of the affected skin can actually evolve into full-blown skin cancer if the heat exposure continues and the rash goes untreated long enough. I think the most fascinating hypothesis as to why firefighters develop skin cancer at an increased rate is actually the shift work hypothesis. It's been observed that shift workers, meaning those that work overnight shifts, have a higher incidence of cancers, including breast, prostate, and GI tract cancer. A 2020 systematic review and meta-analysis, which again is a type of analysis that combines the results from multiple studies and pools the collective results to answer a specific question. Side note, meta-analyses are considered the highest tier of medical and scientific evidence. This meta-analysis demonstrated that shift work is associated with an increased risk of melanoma, and that this risk is cumulative, meaning more years of shift work correlated with increased risk of melanoma. Interestingly, the same study showed that there was a reduction in the incidence of basal cell carcinoma, one of those non-melanoma skin cancers, and no apparent change in the risk for developing squamous cell carcinoma, another non-melanoma skin cancer. These results are a little bit confusing because as a clinician and what I like to consider a scientist, I would conclude that if shift work increases one type of skin cancer, it should increase all types of skin cancer. I think that cancer biology is probably far too complex and it's not so cut and dry. So I think it's hard to actually understand the mechanisms by which you can have an increased risk for one type of skin cancer over other types of skin cancer. So I think a question from this study is, why does shift work increase one's risk of cancer, including melanoma? We don't exactly know the answer, but it seems that disruption and desynchronization of circadian rhythm with respect to sleep cycles and melatonin production actually predisposes to a whole host of adverse health effects, including cardiovascular, neuropsychiatric, and endocrine disorders, as well as the development of cancer. So really, this study underscores the importance of adhering to a regular sleep cycle, meaning going to sleep and waking at the same time every day. The body apparently loves routine, and bringing it back to the point of this video, this data supports that firefighters again have an elevated risk of developing skin cancer, not just from their exposures, but also based on their shift work schedules. So if you're a firefighter, a logical question from my video may be, how do I reduce the odds of developing skin cancer? Great question. I think without going into too much detail, a few practical things you can do. One is to wash off immediately after your exposure to a firefighting event. Change out of your personal protective equipment, clean the PPE very well. The data clearly indicate that harmful chemicals remain on your PPE unless you manually remove those chemicals by washing. There are even ongoing initiatives that seek to educate firefighters on this very practice and to implement changes on a system-wide level to improve cancer risk and reduction in firefighters. The second thing you can do is to use sunscreen when you spend time outdoors, even while on your shifts. You want to invest in a good mineral-based UV filter, such as one containing zinc oxide or titanium dioxide. 3, avoid exposure to known carcinogens to the best of your ability. That means avoiding smoking tobacco, avoiding excessive consumption of alcohol, avoiding tanning bed use, and avoiding processed meats. I don't want to get controversial, but there is data that processed meats, such as deli meats, are actually carcinogens. In fact, the National Toxicology Program does categorize deli meats and processed meats as type 1 carcinogens. I think adopting a plant-based diet, or at least incorporating fresh fruits and vegetables into your diet as much as possible, may be very beneficial for your overall health. 4, I recommend you get adequate sleep. I think you should look at information from Matthew Walker, the sleep scientist from UC Berkeley. And lastly, get regular checks from your dermatologist. Do it at least annually if you've been a firefighter for more than a year, especially if you do it full time. If you don't have a good dermatologist, go to aad.org. Click the Find a Dermatologist link. I'll include a link in the video description. To summarize this video, firefighters appear to have an increased risk of developing skin cancer, and this risk appears to be directly related to the exposures and shift work that firefighters have. If you have a family member or a friend who's a firefighter, please share this video with them. I wanted to conclude this video with a little story about my experience with firefighters. So I actually see a lot of firefighters as a dermatologist in my clinic, and they're great guys. And I haven't met too many firefighter ladies, but I'm sure they're equally nice. But I wanted to share a little anecdote that happened at the height of the COVID pandemic. So in 2020, this was around May, my wife and I were going on a walk. We were going to take a hike with my girls. I have 2 twins that were actually born the year of COVID. Basically, we had been going on hikes to try to get outside and keep our sanity during the midst of the pandemic. And one day we were actually leaving our house, and my wife was carrying one of my daughters, and in an effort not to drop my daughter because she ended up slipping while carrying a glass bottle, she didn't want to drop my daughter on her head, and so she ended up turning in a way where she had to fall on her outstretched arm. And she actually dropped this glass bottle before she fell and hit the ground. And that glass bottle ended up severing her wrist, like cutting it clean. Thankfully, she did not drop my daughter. My daughter is totally fine, thank God. But she started bleeding a lot. And I actually had to tourniquet her arm before we could call 911 because of how much she was bleeding. Tourniquet means you wrap something tight around a limb to cut off circulation so that it stops bleeding. So I used my belt, I tourniqueted her arm, and we got her to stop bleeding. She was freaked out. She thought she was going to die. Thankfully, our neighbor was actually outside. We hadn't even left our house. Our neighbor was outside. She called 911. The firefighters showed up to our house within, I'm not even exaggerating here, probably 3 minutes. And they rushed my wife to the emergency room. She had emergency surgery that very day, I think within like 2 hours. I couldn't even go to be with her because of the COVID restrictions. You were not allowed to have any visitors at the time, which was insane. So this whole event was shocking and traumatizing for my wife, for myself, for my daughter, obviously, who almost got dropped. But the firefighters were the heroes of that day because they were there within minutes. Oh, I can't thank these guys enough. And frankly, I don't think servicemen like firefighters and police officers are thanked enough. So I want to do that in this video. Thank you to firefighters. Don't let my videos scare you off from doing your job. And I just want to recognize you all. Thank you for what you do. You put your lives on the line every day to help folks like my wife in their hour of need. Thank you for what you do. And this video was made for you so that you would hopefully implement these changes in your life to reduce your overall risk of cancer. And with that, I just want to thank you all for watching my video. If you like the content, learned something new, or just enjoyed watching me geek out over skin-related content, please like my video and subscribe to my channel. I'll continue to post videos on a weekly basis. If you have a topic that you'd like for me to cover, leave a comment, and I'll do my best to answer your requests in an upcoming video. I would also like to say that this was a very lengthy video. I hope to keep other videos shorter. I just wanted to review the data in its entirety. And I'm also going to be making videos that are of interest to me and hopefully to you. So I will definitely get into the details on skin cancer and photoprotection. I'll be doing videos like that in the future. Thanks again. See you soon.